Welcome to Business Talk, a global podcast series where we bring you closer to some of the world's distinguished scholars and their impactful ideas. I'm Deepak, your host from India. What does it take to build a workplace where people don't just survive but truly thrive? It sounds like a simple question, but for most organizations, it remains one of the hardest to answer. One researcher has made it to her life's work to find out. Born and raised in Turkey, Dr. Duygu Biricik Gulseren's journey began far from the corridors of organizational psychology. She started with engineering, but somewhere along the way, she became captivated by a different kind of structure, the invisible architecture of human experience at work. What makes people feel safe? What breaks them down quietly while anyone noticing and without? And what kind of leadership actually heals rather than harms? Those questions lead her across disciplines from engineering to social psychology, and finally to industrial psychology, and ultimately to York University, where she now serves as an associate professor at the School of Human Resource Management. At York University, Professor Gulseren sits at the intersection of psychology and organizational science, studying how leadership shapes employee health, well-being, and safety. But perhaps her most quietly powerful contribution has been shining a light on something most workplaces choose not to see: chronic pain. Her research on invisible disabilities has made her one of the Canada's most important voices on workplace inclusion, asking organizations to reckon with the workers who show up every day carrying burdens no performance review will ever capture. Her work didn't go unnoticed. In 2024, she received the Canadian Society for Industrial and Organizational Psychology Outstanding Early Career Researcher Award, a recognition of both the rigor and the humanity she brings to her scholarship. She also developed the Right Leadership Model, a science-based framework designed to help leaders build psychologically healthy workplaces, not as a wellness initiative, but as a leadership philosophy. Beyond her research, Dr. Gulsering serves as the chair of the Canadian Society for Industrial Psychology and sits on the editorial boards of four leading academic journals, shaping not just her own field, but the direction of the discipline itself. Today, she joins us on Business Talk to explore her research, keeping in or pushing out, an integrative framework of substances and substance related control in organizations. A study that challenges how we think about control, policy, and humanity within organizational life. It's a true honor to welcome you here, Professor Duygu Biricik Gulseren. Thank you so much for joining today.
Thank you very much for having me, and that was a great introduction, very lovely introduction. Thank you.
Thank you. Professor, most workplaces research on substances focuses on harm and prevention. But your paper challenges us to zoom out. What made you realize that the existing conversation was too narrow? And what was the moment you decided to reframe it entirely?
Yeah, I mean, before I answer this question, I just want to give a quick shout out to my colleague and co-author and collaborator and very dear friend, Dr. Zhanna Lyubykh from the BD School of Business at Simon Fraser University. This project actually started with Zhanna and I, like we've been collaborating for a while now, and we both have shared interest in workplace inclusivity and health and well-being. So our initial goal was to review the entire research landscape on substances in the workplace. And we wanted to understand how substance use interacts with the inclusion and exclusion of employees as well as job applicants. But after reviewing approximately 3,000, 4,000 papers, we began to see a very different picture. So substance use turned out to be only a small part of the broader conversation on substances in the workplace. And, there's this prevailing assumption that substance use is, primarily creates harm for employees and organizations, therefore, must prevent it. But the evidence that we found was much more nuanced. So we found that substances may not always be harmful. Sometimes they can be beneficial, or, in many cases, they may have mutual consequences for organizations. And more importantly, we realized that substances shape workplaces in ways that extend beyond the substance use itself. So the discussion of substances can be there without the actual substance use.
Professor, you introduced the idea that substances can surface in the workplace in ways that go far beyond personal use. Can you walk our listeners through what surfacing means in your framework and give us a real world example that might surprise people?
Yeah, I mean, substance surfacing is a term that we introduced in the paper. It's an umbrella term, and we introduce it to describe how substances can become present, perceptible, or influential within organizations. So the key idea is that substances can surface, so, quote unquote surface, in the organizational life, even in the absence of any physical presence of substances in the workplace. So like in addition to using substances or like being impaired by substances, substances can also surface in workplace through socially constructed ways. So like through shared norms, shared conversations on substances, assumptions, stigma, sometimes policies and procedures. So for instance, like you can have an office where no one is actually using any substances, yet substances are still present there in meaningful ways because they shape how people think about colleagues. They shape how people interpret each other's behaviors, what kinds of judgments or concerns circulate informally. So substance surfacing captures this broader idea that substances do not need to be physically present to be organizationally real or relevant. They can also operate through meaning, through norms, and institutional mechanisms. So in our paper, we offer 3 different ways substances can surface in organizations, and we name them as experiential, contextual, and procedural.
Professor, your framework identifies experiential surfacing, meaning how individuals personally involve themselves with substances. How does that lived, often hidden experience play out inside professional environments? And why does it matter to leaders and HR professionals?
Yeah, I mean, experiential surfacing probably of all those 3 categories could be the most familiar to many of us. And as you suggested, it captures employees' direct and personal experiences with substances. So it can involve substance use, being impaired by substances, coming to work hangover, and interestingly, abstinence is also a form of experiential surfacing. So, because it is a substance related experience too. So, if you choose not to drink alcohol at a work event, for instance, you still have an experience with the substance. So 2 things about this lived experience of substances or experiential surfacing stand out to me. First of all, like it's mostly hidden. So we don't know who is using, who is under the influence of a substance. We just make assumptions. So there was one study that we reviewed, and there's an employee like reporting their alcohol dependence. And this employee like shared that they have concealed their alcohol dependence for 15 years, but they carried a water bottle to work every day, and that water bottle was filled with wine. So like he has been doing this for 15 years. And like people can go to remarkable lengths to conceal both use and non-use. Sometimes, non-use can also be concealed. So what I'm trying to say here is that what others see is rarely the full picture about experiential surfacing. Secondly, experiential surfacing is often not random, like it is shaped by the work and work conditions itself. So workplace harassment, traumatic events, job hazards, heavy demands like shift work, these conditions all increase the likelihood that employees turn to substances. And we know, like in our research, one of the most striking findings, well, striking but not surprising, that many workers use substances to psychologically survive their jobs. In our review, again, like we came across one study. It was about the sanitation workers in Sierra Leone. And they use substances to create a symbolic difference between themselves and their inhumane work conditions. So like they were using substances to detach from work, at work. There was another study again that shows that employees who interact heavily with artificial intelligence uh, actually experience loneliness more, and they turn to alcohol to cope with the loneliness. So, in short, my message to all leaders and HR professionals is that substance involvement or experiential surfacing is often not the major problem. I urge them to treat it as a signal of a bigger problem. It can tell you about it can tell you many things about work conditions. So if your organization only responds to substance use and try to limit it, probably they are missing the underlying causes. And to me, the more productive question of a leader should ask is not who is using, but it should be what about our work environment that might be contributing to substance use.
Professor, you talk about contextual surfacing, the informal norms and unspoken cultures around substances in organizations. We have all heard of the after work drinks culture. How deeply do these invisible norms shape inclusion, belongingness, and even career advancement?
Mm-hmm. Yeah, I mean, as you said, contextual surfacing is about how substances live within the culture of an organization. So norms, rituals, conversations, shared expectations, you name it. And after work drinks are a perfect example of this. And because these invisible norms run much deeper than most people realize. So on one hand, such after work drinks culture can genuinely build connection. Teams can bond over drinking, and it can signal solidarity, loyalty. We know that many business deals get done in over drinks, so it can strengthen relationships with clients. And again, like in our review, there was one study that found that even like organizations signaling permissive drinking norms uh, were able to attract job candidates with stronger political skills. And for that particular work context, having political skills was a competitive advantage. So like they could probably increase their talent pool and hire the type of people that they wanted by signaling permissive drinking culture. But also there is a real cost, Deepak, and it falls on those people who don't, take part in drinking cultures or substance cultures. So like professionals who abstain can be, labeled as marginal characters, or they can be, disliked by colleagues who are deep into the drinking cultures. And there are a number of studies on the, non-users in the workplace, and we know that they can experience identity threats. They can feel exclusion. They may have limited access to career opportunities. And there is even a survey showing that people who don't drink, like compared to the employees who drink, they have diminished earning potentials. So there was one study that followed British Muslim women whose religious beliefs conflicted with the pub-based networking culture in the UK, and yeah, I mean these women didn't drink, but they still went to the pub because opting out of the pub culture meant opting out of career development and networking opportunities. So they had to foreground their professional identity over their religious identity in a way. Just to feel the belonging. So these norms are contagious. Newcomers who observe, more senior colleagues drinking heavily may gradually increase their own drinking just to fit in. And when there's, advancement, mentorship, deal making happen around alcohol, of course, the drinking culture may quietly become the gatekeeping mechanism. So, considering all of these, my advice for leaders is to audit their informal rituals as well, not just the formal side of their work, but their culture, and ask like who is included in our design here and who is excluded by default.
Professor, then there is a structural surfacing, the formal policies and procedures and practices. Your research suggests that policies aren't always as protective as we think. Where do most organizational substance policies fall short? And what does a truly thoughtful policy look like?
Yeah, I mean, by structural surfacing, we mean the written policies, drug testing policies, employee assistance programs, like managerial training on substances. And to be fair, the evidence shows that these, formal structures are really powerful and they can work. So drug testing can reduce substance use. It can improve safety outcomes in the workplace. We also see that training managers increases early intervention and referrals for employee assistance programs. When there is, available resources in the workplace like supportive programs, it encourages employees to seek help. But despite all these benefits, we also saw in our review that policies may fall short in a few predictable ways. First of all, like heavy-handed approaches backfire, and they backfire both socially and economically. There was one study on the U.S. Navy's the zero tolerance policy in the U.S. Navy. And so in this study, the U.S. Navy dismissed employees who consumed substances, and their argument was the productivity loss. So like consuming substances led to productivity decreases, and therefore the organization decided to let go of those employees. But in the long term, they realized that the cost of replacing those dismissed personnel outweigh the productivity savings. So like by taking a strict zero tolerance policy, they actually had a net negative in this organization. And also like enforcement is another critical aspect of policies. So we know that enforcement can often be weaker than what it looks on paper. So like in reality, you might have a random drug testing, but on paper you might have a random drug testing, but in reality, many employees either know or can guess when they will be drug tested, and they can prepare those, random tests. And to me, the most troubling part is the unequal enforcement of policies. So there are a few studies that show that work sites with more racial minority employees, they are more likely to test and find positive testing. So in other words, like when there is a concentration of racial minority in the workplace, they get more tested than majority employees. We also saw that they are more likely to be fired when tested positive, and they are less likely to be referred for treatment. So, and also, like in addition to those unequal enforcement, policies can also be perceived unfair by employees, and it can erode trust significantly. Again, like there are a few studies showing that when the policies, the substance policies are perceived unfair, it can lead to withdrawal, turnover, workplace protests, like increased tensions with the labor unions. And like considering all of these, I think a thoughtful policy must be comprehensive rather than punitive. So like instead of just having drug testing and zero tolerance, maybe it should combine information, education, and genuine assistance, not just testing alone. And of course, like it must be applied consistently and transparently to everyone. And they must also protect the privacy and the dignity of employees.
Professor, the title of your paper is striking, keeping in or pushing out. Can you unpack what the tension means? And when organizations try to control substances, are they inadvertently marginalize people rather than supporting them?
Yeah, Zhanna and I have really thought about this, like discussed this title quite a lot. And it summarizes the central tension that we found in the literature when we, reviewed all these published research. So most studies are built on the assumption that substances are bad. So the goal for organizations must be to push them out of workplaces. But as I said, like our review shows that, this is one of the multiple narratives. So individuals, groups, organizations may sometimes want to keep substances in. They may want to tolerate them or even embrace them as a part of how the work gets done. So this title reflects that tension, and we explain this tension from a lens of control. So most of the time, someone in the organization, like it can be the organization itself, HR, it can be team, or it can be a quite powerful founder, for instance. These significant, powerful figures can establish and control the dominant narrative about substances. And other people can just respond to that control. They can comply, they can resist the control, or they can, manage their own identities by concealing, compensating, reframing their substance use. And some people just, manage to escape from the control altogether. And of course, like control, absolute control can marginalize substances rather than support.
Professor, one of the most provocative claims in your research is that substance-related implications are not always negative. That's likely to raise eyebrows. What does the evidence say, and how should organizations begin to think more honestly about this spectrum?
I mean, before I answer your question, let me start with an important caveat. We are not, encouraging substance use, and we see that the harms are real and they are well documented. So that there is, dependence, injuries, aggression, absenteeism, even mortality that can come due to consuming substances. But what we are trying to say is that this is not the only picture. And honest, reading of the evidence shows that the picture is not uniformly negative, it's not uniformly positive, and we're not pretending that it is always dangerous. But what we see is that at the individual level, substances, for instance, can sometimes help employees with coping, like they can function as a coping mechanism. They can help people endure genuinely harsh work. So this is a benefit that, might be one of the many benefits that we cannot, ignore. We also know that some substances can act as cognitive enhancers, and cognitive enhancement can improve, can lead to performance improvements from time to time. There is one fascinating study within the papers that we reviewed, and they found that cannabis users generated more original new venture ideas. So like it was tied to innovation. Though they also admitted that these more original ideas were less feasible compared to people who don't compared to the ideas of the people who don't consume cannabis. There's even an evidence that employees who drink have higher lifetime earnings, possibly because drinking is woven into networking and relationship building. So these are at the individual level. At the group level, we also see shared rituals around alcohol, and it can foster social integration, solidarity, team loyalty. I don't see this a lot in Canada, to be fair. Perhaps you are familiar with this picture from India. But where Turkey is where I'm from. In Turkish workplaces, you see, a group of people going outside together as a team to take a smoking break. And people who don't, smoke in those breaks, they're just not part of the pack. So apart from those, individual and group level observations, we also see at the structural level, cannabis legalization, for instance, has been associated with fewer workplace fatalities, particularly among young workers. In some cases, it improved worker health, even more innovation. So like we one study showed that firms generated more patents, likely because they could attract a larger talent pool by keeping cannabis as legal and free. So, how should organizations think about this more honestly? And probably starts with accepting the risks as well as the benefits coexisting together. And here the context matters enormously. Of course, I'm not saying that a highly safety critical industry should allow substance usage. Again, like depending on the context, of course, restrictions might be more, but I think in general, accepting that risks and benefits they coexist together is a good idea. And also, we should probably accept that trying to fully eradicate substances is either unfeasible, or costly or ineffective. So, like to me, this is not like fully getting rid of substances, pushing them out in the workplace. To me, is not feasible. And thirdly, and I think this is the key one, we should ask all leaders and HR professionals, we should ask what function substances are serving in our workplace. Like if your employees are drinking to cope with their jobs, again, the problem you need to solve is not the drinking, it's the job.
Professor, given your broader research on chronic pain and invisible conditions at work, how does substance work and use, particularly prescription medication or pain management, intersect with disability inclusion and psychological safety at work?
Yeah, I mean, this is where two of my research streams really meet, and it's a connection that I find really interesting. So, I mean, think about an employee with chronic pain. So, like chronic pain is an invisible condition, and many people with chronic pain may rely on prescription medication, including opioids, to be able to function in their everyday life, including work. So in a workplace with very strict substance narrative and drug testing, that person now carries a double invisibility. So like there's this hidden condition, like mostly hidden condition, and there's also a a treatment that is being stigmatized, and they're trying to manage it in a hidden way as well. And our review shows that many people conceal, particularly opioid use. So they hide medications, they avoid disclosure, they try to manage their image very carefully. And the same concealment, same compensation, same reframing strategies that we see in other stigmatized identities also apply to this context as well. And in our future research agenda, we flagged the real possibility that employees may avoid or delay legitimate medical help seeking because they have fear of testing positive. And like when they delay their treatment, it can worsen their condition. So that is a policy designed for safety. It can actively harm the health of employees. And we think there's also a deeper point. The line between the legitimate patient and the substance user, or substance abuser, or misuser is socially constructed. So the same medication carries a completely different meaning depending on the narrative around it. And that narrative is not, black and white. It's often set by people who have never, had to manage pain at work. So I think the implications are clear. If employees cannot safely disclose, organizations will eventually lose the ability to accommodate and support their employees.
Professor, if a chief human officer is listening to this right now, what is the one blind spot in their current substance-related policies that your research would urge them to address immediately?
I think the answer is the gap between the policy on paper and the policy in practice. So most CHROs believe their substance policy is applied uniformly, especially when they are at a higher strategic level position. They may not be aware of the day-to-day realities of their workplaces. But our review suggests that most of the time, this is not the case. And that is literally what we call as escaping substance-related control in our framework. So random testing policies seldom work because employees can't predict. Enforcement often falls harder on some racial groups than others. High performers, senior leaders, hard to replace occupations can be exempted even though like they use substances and the policy like openly bans it, they can be exempted due to the value that they bring to the organization. And there could also be microclimates, and by that I mean influential people can create spaces the official policies simply cannot reach. So meanwhile, the same organization may also be sponsoring happy hours that contradict with their own, written policy. So the question I would urge every CHRO is to ask, this week, hopefully, as soon as they listen to this podcast, is our policy actually applied the way we think it is?
Professor, I would like to conclude this episode with one last question. Your paper synthesizes 361 articles and maps a field that is fragmented and under-theorized. What is the most urgent question that researchers and organizations must now confront? And what gives you hope about where this conversation is heading?
Well, I mean, with this paper, we hope to shift the conversation of substances in the workplace from how do we eliminate substances to who gets to set the narrative around substances at work and who bears the cost. And we need to understand how substance-related control is established, how it is contested, how it is applied. So, for example, can employees collectively change a substance narrative? We also need to understand what it means for inclusion. So, for example, have overlapping identities who is subjected to control and who escapes it. So I think my bottom line message again for organizations is that the urgent task is honestly like let's confront our blind spots first.
And that I believe is exactly the kind of conversation workplaces need to start having, not just in boardrooms, but at every level of an organization. Professor Gulseren, thank you for bringing both the science and humanity to this topic. You have given our listeners not just new knowledge, but a new way of seeing, and that is the rarest gift a researcher can offer. To our listeners, if today's conversation sparked something in you, a question, a reflection, or perhaps a much needed conversation within your team, then we have done our job. Don't forget to share this episode, and as always, keep thinking, keep questioning, and keep building workplaces worthy of the people in them. Until next time, Business Talk, thank you for being here. Thank you so much, Professor Gulseren, not just sharing the time you have given us today, but for the years of quite rigorous work that made this conversation possible in the first place. Thank you so much.
Thank you so much for having me. It was a pleasure chatting with you.